normally anybody who has a urinary symptom, frequency, pain, burning sensation, it is expected that this person may be having an infection. So most of these patients who present to their initial doctors with burning sensation in the urinary passage, or pain in the urinary passage, or pain in the lower abdomen, and frequent visits to the washroom, getting up 4 or 5 times or even more at night, they are treated as infections. It is not wrong also, because majority of these patients who present with these symptoms for the first time, they would have a urinary infection. So an empirical treatment with antibiotics is good enough. But if within 2 to 3 days the symptoms don't resolve, or they keep coming back again and again, it is very important that the very next episode that the person presents with these symptoms, he or she should undergo a detailed urinary examination to exclude the infection. So if the infection is excluded, that is when the clinician should be as alerted to a diagnosis which is different from infection. So the clinician must understand that this patient perhaps is suffering from something which is not infection. The internist, the usual gynecologist, or the surgeon who is looking after these patients would actually miss the diagnosis, and they will keep treating them. As a result, when these patients have visited a lot of doctors, a lot of times, they get a combination of various antibiotics, various medications, and they build up a file of their medical records pertaining to this. So a patient who walks into my clinic who has interstitial cystitis perhaps walks in with a thick wad of consultation papers and investigations, and with a very depressive look on their faces, not only there but their caretakers, like usually a spouse in this case. And they are frustrated. They do not believe that you are going to treat them. Somebody has suggested a urologist or somebody's name, and that is why, to oblige that third person, they would come and visit you. They have by now been convinced that their treatment is neither possible nor is their diagnosis. The symptoms which are very typical of bladder pain syndrome are that you are waking up at night very frequently to visit the washroom, and when you wake up, it is the pain or burning sensation rather than a desire to pass urine when you are going to the washroom. The patient has usually learned that by going to the washroom and reducing the bladder volume or evacuating the bladder would reduce the symptoms. The symptoms are pain, burning, or discomfort in the lower abdomen in the urinary passage.